What's up, y'all? This is Carolina Doc, PT. And when could you ice? Could you ice if you think or suspect that you might actually have a fracture? Should you wrap your ice pack in a towel? So we're going to talk about and provide answers to those questions and some more in today's video. What's up, y'all? So this is a question that I get more often than you would think. Like, a matter of fact, I thought that this video topic might be so simple that I shouldn't do it. But also, in light of some things that have kind of been hearing in recent research and from some other PTs, I decided that no, I think there's a lot of misconceptions because I have a lot of patients just coincidentally recently who've been asking me about this and how you actually ice appropriately. So that's what we're going to be talking about. So, um, the ice, the first things you're going to think about is, one, no, if you have a fracture, icing is not going to help. Well, let's just go ahead and answer that question right off the bat. I actually sometimes have used that and have been known to use that in the clinic when I suspect, like a patient might come into to us with, say, an ankle sprain or what they think is an ankle sprain, but then some of the things and signs that they're giving off kind of are leading me to a different conclusion. Well, oftentimes I might say, you know what, let's just put some ice on this and see how it does. And usually, very quickly, if it's an actual fracture, those patients will start saying, you've got to take this off. I'm about to jump out of my skin. Icing a fracture is no bueno. It's not good. Patients don't like it. However, if you're trying to diagnose and trying to determine if someone has a fracture or not, it can actually be a really good resource for that. Um, no, you would not ice a fracture. You're going to ice anything that I would say any recent injury that you've had, whether it's a muscle, a joint, that's not a fracture. You would want to ice. You are going to ice that injury. Like, the first thing that you're going to think, you are hurt, and it doesn't really matter where in the body for the most part that you're talking about. If you hurt a shoulder, if you hurt your back, your first thought should be, I need to ice. Because when you have that injury to begin with, your body is going to try to start healing itself, okay? And it's going to actually kick up inflammatory byproducts in that healing process. When those inflammatory byproducts are kicked up, they're going to start sending off pain signals because of just um, the chemicals that are being involved there. And that's what's gonna be, or at least that's one of the things. There's a whole discussion you could go around the pain cascade and the inflammation cascade that and how inflammation actually happens in the body. But basically, you would say more blood flows coming to that area to try to help heal that area up, and inflammatory byproducts are being kicked up, which is leading to more pain. So, what's your first thought after you have an injury? Going to be, I need to put some ice on this, okay? Because what you're wanting to do is you're wanting to push blood flow away to tamp down that um, that inflammation process. Okay, you want your body to help heal you, but sometimes there is such a thing as too much of a good thing, right? And so that's kind of what's happening. When your body has an injury. So you're want to think, hey, I'm going to put some ice on this. I'm going to put my ice on my shoulder. I'm going to put it on my back. I'm going to put it on my knee and try to push that blood flow away. So, how do you ice? So, this is where a big misconception comes in. So, a lot of times people will use, say, an ice pack, and they will wrap it into a towel, and then they'll put that towel on top of, say, their sweatpants that they're wearing, and then they'll ice for like, 30 or 35 minutes, something like that. And then they'll be like, well, my knee is still hurting, say, or my shoulder or whatever we're talking about, the body part injury is. So that's incorrect. Okay. The point of ice is you are trying to make that area of the injury cold, cold. Okay. We are trying to push blood flow away to calm everything down. You want to think that you were trying to like this is a little bit of a fire, and we are trying to put a blanket on top of that to try to tamp down that fire and calm that down. That's sort of that's a little bit of the mindset that you want to have. And so that ice pack is that blanket going over top of the fire. Um, so for that to happen, it needs to be really cold. So you're going to want to have the ice pack. Well, step back. If you're using ice cubes alone, you're just putting ice cubes in a plastic bag, then you want to put those ice cubes in the bag, then put the bag, that plastic bag, directly on your skin. Okay. Because that ice is not going to ever get colder than 32 degrees or slightly above 32 degrees. I generally will tell patients, after you do that, you can put the towel, say, around the outside of that because, yes, that it's going to start melting and you're going to get increased condensation. And so you don't want that to be running everywhere. And so the towel will help to soak that up. But between the ice cubes and uh, the area that you're trying to ice, the painful area, the only thing should be the plastic bag, and that's it. Okay. So because you're trying to make this cold. All right. Um, if you're using a gel pack, and so that's going to be one like I'll show you. This is the type of gel pack that I typically like. So let me come over to a gel pack that I prefer to use. These things get super cold. That's why I like them so much. I use these personally at home. With our family, I use these in the clinic. These are the ones. I mean, like I've we used to sell these in the clinic to patients. Same brand. So I'm very much sold on this type of ice pack. One thing about this ice pack that you do need to know though is that it doesn't come with a sleeve. So you've got to put this into a pillowcase, but I think that's better anyway because a pillowcase is exactly the right thickness. Like you don't need to have something super thick when you're using an ice pack. Um, it needs to be just a little bit of a thin barrier just to prevent any um, frostbite or anything like that. But you would not want to use this without having some sort of a sleeve or as I said, a thin barrier. If you use this directly on your skin, then you can actually get frostbite from it. Yeah, you don't want to do that. So this is a good gel. This is a really good ice pack, I would say, and I will put this into the show notes below the video. So once you've got one of those gel packs, what you're going to do, there are two different things. So that the gel packs sometimes will come with a sleeve. They come with a sleeve. You're going to want to slide that gel pack into the sleeve that it came with, and then that sleeve goes directly on your skin. If the gel pack does not come with a sleeve, which those cold packs actually don't, which is I think is good because the what I like to do is put them into, and what we would always do in the clinic, is just slide them into a pillowcase, and then the pillowcase goes directly on your skin. Because again, you're trying to get cold colds. You don't want to have too much of a barrier there. If you wrap a towel around all of that and then put it over top of your clothes, then you're pushing away all the cold. You're not getting the full benefit of what ice can actually do. So or what cold can actually do. So you're going to take that cold pack, slide it into a pillowcase, then put that pillowcase directly on your knee or directly on your shoulder. Then you're going to want to leave that there for about 20 to 25 minutes. Ideally, you're going to go through the process of it's going to feel cold when you first apply it, and then it's going to start to burn, and then it's going to throb, but then it's going to go numb. You are trying to ice all the way to the point of numbness. Okay. So that's the good thing about that is that's where you have no pain. So that's what a lot of times patients will not like to use ice because they they don't like those first couple of things. Like, yeah, you put it on, it's cold. Yeah, it does start to burn. That doesn't feel very good. It does start to throb. But if you can get all the way to numbness, then numbness takes away the pain completely and you don't feel anything anymore. So that's where it can be really, really beneficial. And so it's also helping to push out that inflammation so that then, as I say, you're kind of calming the issue down. Um, and then after about that 20 to 25 minutes, you want to take that off, and if you're early on in the process, You wait for 30 minutes to an hour, and then you can do that again. You can do that kind of throughout the day. There's really not a set limit that you need to do. It kind of just depends on your tolerance and how badly you're injured. As I say, ice is not great on fractures, but for sprains and sore muscles and all that type stuff, it can be very beneficial for those types of injuries, especially when they're new. Okay. Um, so if you're early on, if you're within and this is another critical juncture of as to when you use ice. So when an injury is new, we're talking about within the first about 48 hours, you want to ice. Okay. It actually is never wrong to ice. You can ice anytime, but especially within those first 48 hours, that's when you want to ice. You do not want to heat within the first 48 hours of any sort of an injury. Also, if you've had a surgery, let's say like a knee replacement surgery or something, that's something else that you're going to want to ice for probably a week or two, honestly. You're for sure the first several days, and then you'll kind of wean yourself down. But you're not going to want to put heat on that within the first few weeks. Okay. But part of that is because of what we talked about to begin with. You want to think about the inflammatory process. So you have a new knee that you're trying to make move, or let's say it's your shoulder and you're trying to get range of motion on it, or you're trying to, do s do some early kind of strengthening, not strength, but early kind of, range of motion work on it, um, then you are re-inflaming that every time you move it, because it's a new knee. There's no or it's a new shoulder. There's no the things have not healed yet. So anything you do is gonna increase your inflammation. If you put heat on that, that's like dumping gasoline on a fire, and it's gonna make it much worse. You wanna push that blood flow away, then let calm that inflammatory process down. Then take the ice off, blood flow will come back. That blood flow, you do need blood flow. Don't get me wrong. That's why also you don't just sit on ice packs without just forever and ever. Occasionally, patients will say like, I just have to keep the ice currently on. That's not ideal. You because you the area does need healing. Okay, it does need that blood flow. Not only is it kicking up inflammation when it happens, but more importantly, the blood is bringing in oxygen, and it is helping to take away some of those inflammatory byproducts. So if you just keep pushing the blood flow away, um, it's not getting oxygen, so that's not good. You do want to give it some relief. So you're going to ice it, then wait about 25 to 30 minutes, maybe at minimum, and then maybe an hour or two, just until it gets back to feeling normal temperature, and then you can ice it again. And you can kind of go through that process throughout the day. Usually I'll tell patients, to ice somewhere in the, 4 to 6 times a day if needed. If you need to, you can do it a little bit more than that, but somewhere around that. Some surgeons, like after knee surgeries and things, they'll say like every hour to start. And then as you continue to do this over time, you do want to start weaning yourself off over the next week or two from the ice because you can get used to the ice and things. Also, I did want to address one other thing that I've kind of recently heard and looked at, and I haven't fully looked at these studies myself, but apparently they're starting to teach in DPT schools that ice is not necessarily beneficial. So I need to research this a little bit more myself before I go full in on this. But I heard this recently from another therapist, and um, that's ridiculous. Is all I'm going to say about that. I would question the study. There is way too much evidence and experience that people have had with, I mean, heck, just myself and recovering from different injuries or different things, like when I was doing marathons and things. Ice is absolutely beneficial. Ice can absolutely help you. It can absolutely help you to tolerate and deal with pain much better. It can help you recover from injuries, especially early on. That's where it's really beneficial. It can help you to deal with pain anyone that would say that ice is not beneficial for you, or that you shouldn't use ice, anything like that, that's ridiculous. Okay, don't listen to that person. That's not backed up by worlds of evidence. And when you're looking at, I would say to you PTs out there, especially you younger PTs, when you're looking at the way that you are practicing using evidence based physical therapy, well, part of evidence based is what the therapist has actually had experience with themselves. It's not 100% based on research. Okay. That's a piece of the pie, but the other piece is what does that therapist have experience with and knows is beneficial to their patient. And ice can be beneficial to a patient when when they're early on in an injury. All right, so I hope that that helps educates you on when you should use ice and how you should do it, and hopefully that will help you in the future. Look at for the next video that I'm going to do, because this one wound up being a little bit longer than I was expecting. So I'm actually going to do a second one now on heat and when you should be using heat. So y'all can look over there and check that out. All right, you have a good one. Bye.